the Commonwealth of Virginia. The United States is pushing for higher vaccination rates as we turn back to the COVID story now, as the number of COVID infections surge around the country. Former Health and Human Services Secretary Dr. Tom Price says in the meantime, we need to make at-home testing more available, and he joins us now with more. So thank you so much, Mr. Secretary, for joining us. We're hoping this vaccine is going to work. We now have just news out a few minutes ago about Johnson & Johnson, their candidate. They're going to get ruling on by March. In the meantime, it's clear we're going to need to do a lot between now and then, whenever the then is, to protect ourselves. Give us your approach.
Well, you're spot on, because the then is likely months and months and maybe even to the midsummer or early fall before the vaccines are going to have the kind of effect that we want in our society so that we're able to go about and do the things that we'd like to do. So information is key for individuals. More information is absolutely vital. In the meantime, it's important, especially with this spike right now, that we increase our ability to test. And at-home testing with a saliva test where you get the response back in real time, basically within 45 minutes or so that you can make decisions about what it is that you're going to do. And you know that you can keep other people safe if you know that you're not carrying the virus at that point in time. So science is rapidly moving ahead, and this test is available. But the problem is that it requires a prescription. It requires the kind of bureaucracy, either through physicians' offices or through hospitals or through pharmacies. Individuals ought to be able to just go to the drugstore and get a test over the counter, saliva test over the counter, that they can do in the privacy of their own home.
So help me as a true layman here. Why is that? Because I must say, here at Bloomberg, they have a kit they send home to me every week, and I put a swab in my nose myself, and I put it in a pack, and I send it back, and they have a test for it. I don't think I have a prescription for that. Why do I need a prescription?
No, but look where that goes. You do the test, and then it's sent off. And so you wait for the results. Now, some of those results come back within hours. Some of them come back within days. But each and every individual, I believe, ought to be able to have the opportunity to go just to the drugstore and pick up a test. It's like a pregnancy test, for example, that the ease of a pregnancy test or an HIV test. Both of those are over the counter. So we ought to be able to do that. And then individuals can make wise decisions about what it is they're going to do, where they're going to go. Doesn't mean that masks aren't important, or that social distancing isn't important, or that washing your hands or staying at home if you feel ill. But more information is absolutely key in order for us to get our arms around this challenge that we have right now.
Yeah, the scientists certainly all say that. How much does it cost?
Well, that's variable, and it could cost. It could be subsidized. Insurance could pick it up. It could cost anywhere from $5 to $25 or $45. But the important thing is to have it available for folks. And there are many things that could be done, and the FDA ought to be able to approve this kind of thing, even for emergency use, even if it's over the counter. One of the apps is that the sensitivity of it isn't as strong as the other tests, and that's true. But if you're able to do a test repeatedly, then the ability for you to determine whether or not you're a carrier at that point in time increases to the level where we currently would like it to be, which is in the mid-90s.
So why isn't your old shop getting this done as a practical matter? President Trump has said he's going to cut through the regulation, cut through the bureaucracy, particularly to fight this COVID-19, a true crisis. Why isn't it getting done?
Well, I mean, it's precisely why I wrote the editorial that I did, because I think it absolutely needs to be done. And there are all sorts of answers. I'm not on the inside right now, so I don't know what their concerns and objections are about why they haven't approved this for over-the-counter use. But I would encourage folks to let their representatives know and to speak out about it, because this science is available now and ought to be able to move forward.
Let's talk about the administration which you served. We've talked to various people. I talked to Mick Mulvaney last week, who made no bones about the fact that he is very disappointed, thinks he's a different president than what he knew, and really thinks he's besmirched his legacy to some extent. How do you feel, having served in the Trump administration now, given what's happened over the last few days?
Oh, I'm just so sad about what I see right now, and the divisions that I see that aren't seemingly being addressed. This impeachment issue that you're covering today is very concerning, because I think folks have to step back and say, why? Why is this being done? If it's to remove him from office, we know that's not going to work, because the Senate's not coming back until next Monday, and he's being removed from office on Tuesday, given the inauguration. If it's to punish the president, then there are courts of action for that. So I'm left with the fact that it likely is political. And if it's political, then that's not helpful going forward. That's not going to do anything to bring us together and allow us to move to the next step, which is addressing the major issues that the American people want their representatives and senators to address. That is solving the challenges that we have right now. And I don't believe this moves us forward.
So I've talked to several people, part of the administration, who are proud of some of what President Trump accomplished. And he accomplished a decent amount of what he set out to do. Looking back on it now, does this end point really take away much or all of the success that he had?
Well, I think from a narrative standpoint and from an historical standpoint, it likely does. That doesn't take away from the fact that there were incredibly diligent and dedicated individuals within the administration and within the departments of the federal government who did yeoman service and continue to do yeoman service. When I was in Health and Human Services, I had the privilege of leading 80,000 folks all across the world, literally, in trying to make certain that the American people are safer and that their well-being is preserved. So those folks really deserve our incredible gratitude because of the work that they have continued to do in spite of some very challenging situations.
We have a new administration coming in starting next week on the 20th of January. What advice do you have for your successor, for the new head of Health and Human Services?
Well, I think the important thing is to appreciate what needs to be done soon, and soon are the kinds of things to address the current challenge that we have with this pandemic, with COVID-19. What that means is having a consistent voice coming out of D.C., directing folks at the state and local level to be able to move forward with these vaccinations, increasing information for not just providers, not just doctors and other providers, but also for you and for me and every single American about what it is that they must do in order to blunt all of this challenge that we currently have, and then having folks out of Washington working together so that there's a single voice, there's a unified voice about what it is that we're addressing from a health and welfare standpoint. And I think that would go a long way toward allowing us to turn the corner on the challenge that we've currently got.
Okay, really great to have you with us. Thank you very much. Very illuminating. That's former HHS Secretary Dr. Tom